Welcome to RUMC Vital Signs. My name is Alex Lutz. On our show, you'll meet the fantastic people who make Richmond University Medical Center thrive. RUMC is an award-winning full-service hospital located right here on Staten Island at 355 Bard Avenue. To learn more about the full array of services provided at RUMC, visit www.rumcsi.org. According to RAIN, the Rape, Abuse, and Incest National Network, every 68 seconds an American is sexually assaulted. Every 9 minutes, that victim is a child. Sadly, Staten Island is not immune to this growing national epidemic. The number of sexual assault survivors treated at Richmond University Medical Center is on an upward trend and includes minors as well as members of the LGBTQ+ community. Joining me is Isa Shonayan, registered nurse and forensic nurse coordinator at Richmond University Medical Center, which happens to be the only sexual assault forensic examiner center of excellence here on Staten Island. Isa, thanks for joining me.
Thank you for having me.
What are you seeing in terms of the number of sexual assault survivors you're caring for, and why do you think sexual assault cases are rising?
Well, sadly enough, like you just mentioned, it's because I think people are knowledgeable, they're empowered, they also want to take control of their lives, and there's a lot of family support. So there's less of shaming and more of empowerment.
Mm-hmm. Are you noticing any similarities, in cases that you're treating?
Yes. We still see that, the victims are affected mostly by people that they know. Usually the myth is that it's strangers, but it's not. It's always somebody they have trusted, and that is also, a concern. So yeah, and then also we seem to see it's affecting our mental health population. There's a lot of triggering and a lot of re-traumatization, so that increases the visits that we have at the emergency.
And are you seeing an increase in assaults against children, the LGBTQ+ community, or other specific groups here on Staten Island?
Well, I can go by the data that we have. I know that up to the third quarter of this year, it has increased, comparing it to the numbers that we had in 2022. So yes, we have seen it when it comes to children. Also with the LGBTQ community, we don't see a lot of them, but we do provide services for them. And so we want to encourage them, to come, because we do have, we're able to provide the kind of service that will be able to meet their needs.
And I imagine that there is some hesitancy among victims to come forward. Maybe it's embarrassment, maybe it's fear, maybe they're living with their abuser. Do you find that happens a lot?
Yes, and that is why, when patients come in, we want to make sure that they take control of the care and not whoever brings them. Sometimes we have patients that come in because maybe their family members coaxed them to come and said, they want them to come in and have a care done, but we make sure that the patients take control, because it's all about taking control. We just want the patients to take control of their lives and be empowered.
So walk us through when a victim of sexual assault or a survivor of sexual assault comes to RUMC's emergency room. Walk us through the process of the examination and building their trust, the collection of evidence. Kind of walk us through that process. So
when a patient comes in, we have the triage. At triage, we assign them the ESI level 1 and 2, which is our highest level. And then we assign them to a nurse. The safe nurse, usually in the emergency department, we have nurses who have dual roles, as safe and as emergency, so they're assigned to that nurse. The nurse will stay with them. And during the process, consent is a big factor in the care. So that is always ongoing and continuously. So we offer our services. At the same time, we hear what they have to say. We don't do interviews because we're not investigative. But it's very critical to get the history taken, because that really determines how we can do the collection and the kind of care we can give to them. Sexual assault, when it comes to medical forensic care, is not only just about the evidence. It's not just about the kit, it's about the patient itself. So it's a more comprehensive approach. So we also want to make sure that the medical aspect of it, that they're medically stable before we begin the forensic part. So the nurse stays with the patient from the beginning to the end and does not have any other patient. And then also safety is a big part of it too.
And how do you approach when the victim is a child?
So we use, like I had mentioned, consent is an issue. That is part of the care. So when it comes to children, because children do not have the legal capacity to give consent, they don't understand the process. So we use what is called assent, and that's their willingness to participate. If a child is not willing to participate, it's okay, because the care does not stop at the emergency department. We continue with the CAC, which is a Child Advocacy Center. So with children, that is the approach we use. Also, we have to be aware of the jurisdictional laws. So mandatory laws are the nurse examiner has to be she has to be aware of the mandatory laws.
Do you involve the NYPD immediately, or is there a set process, like steps that you go through before you get to that point?
Again, consent. We use consent. We've had instances where patients will come in with law enforcement. We still have to get consent, even if law enforcement had notified the detective. Because we have found in the past that sometimes patients, it becomes a sense of security for them to get to the hospital, and then they could change their minds because of conflicts. So we still have to get consent. Every step of the process and the exam includes consent. Yeah.
And many times you hear about a rape kit. What exactly is a rape kit? How do you use it? And how do you properly store that evidence?
Okay, so the rape kit is actually provided to us by the Department of Justice. It's free, so we order it. The rape kit has 15 steps in it. So what we do is that even it's sealed, we show it to the patient. The patient has to be the one to say that they want it. But then also the law says that they don't have to report it, but we can collect it and hold it for 20 years. Yes, so even we are considered a RUMC, has a 10 days short-term storage, but there is a long-term storage where it's held for 20 years. So the rape kit, every step of the process is explained to the patient, and the patient must give consent before the nurse proceeds. And once we complete that, we release it. That's part of our chain of custody. If they report it, we release it to the law enforcement who is sitting outside. They're sitting outside waiting for that kit, not so much for the patient, but they're guarding the kit. They take the kit to the forensic lab. But if the patient decides they don't want to report it, then we do have our own refrigerator where we store it, and it's in a very secured place.
And the word you keep repeating is consent.
Yes.
How do you build that trust to get consent? Is it conversation? Is it just, how do you build that after what someone has been through?
Yeah, so the first thing we do is that when the patient comes in, we acknowledge, we use the trauma-informed, which is recognizing, realizing, responding, and resisting re-traumatization. So the first thing we say is, I'm sorry that this thing happened to you. Because that shows that we believe them, and we do believe them, because the patient is right. And that really opens up, and then we tell them, what would you want us to do? The patient drives the care. It's not provider-driven, it's patient-driven. The only exception is if the patient is a harm to themselves, or if there's a they're medically unstable, then that is where we have to explain to them that, we take control of the care. But at the same time, the patient can decide that they do not want it. They have the choice to. So again, when I mention consent, is a huge factor in our care because it is patient-driven.
And in your career, you've probably treated, unfortunately, probably thousands of sexual assault victims.
Yes.
Does getting that consent, I imagine it's not something that happens immediately. It takes time to build that. It could take hours, I'm guessing.
Every case is unique. So sometimes the average could be 8 hours, could be longer, could be 12 hours. If a patient wants to stop, we stop. And it's not, the collection is not set in a particular way. You flow with the patient. So if the patient is going through trauma and they're crying, you want to stop and give them that time, to be able to participate, because we want the patient to participate in the care. I use the word patient because in the hospital, we see them as patient victims, as opposed to how our partners would see them.
And I understand that in the new emergency department at RUMC, there is a dedicated area that's specifically for the treatment of sexual assault victims. Can you tell us a little bit about that unit and how it was designed to better meet the needs of victims?
Yes, so it's a very transformational step. with our new emergency department. It's in a secluded area of the emergency department, and what is really unique about it is that we do have a private exit where the patient can leave, without anybody seeing them. We call it the safe suite. So we do have a soft interview area, which is very comfortable, and the patient and that's where the detectives, the law enforcement, or the social workers, or the rape survivor advocates, they can also interact with the patient. And then we have a treatment room. And I think it's good like that because then you're able to separate, the areas. And then also we do have an adjourning bathroom facility. So the showers is accessible for for the patients and also for disability needs.
So when you say this unit in the ED is a secluded area, that's by design?
By design, yes, by design.
And that's a separate entrance and everything, that's for the privacy of the survivor?
Right, if they choose to, or if they choose to come through the front, from the front part of the emergency department, that's okay. But we have been able to provide that avenue that when they're leaving, they can leave privately.
Do you find in your experience that you have people that maybe they don't give consent right away and they leave but come back and
Yes.
are like?
A lot of times.
A lot of times.
Exactly. We've had cases where patients will come and say, and that's why it's patient-driven. I've had instances where patients will come and say, I have to go and pick up my daughter at 2 o'clock. So after we discuss the care, we have to be very transparent with them about the process of the exam. And that gives them the informed decision to make the choices that they want in the care. So we've had instances where patients will say, I'll just do the drug kits and I'll come back. And they might not come back. Also, we've had instances where incident could have happened on Staten Island, but they live in Brooklyn. So we advise them, if you're not able to come, you can go to another safe center over there. And then whoever is investigating the case can come and pick it up.
And SAFE stands for Sexual Assault Forensic Examiner.
I know, I was saying that, yes. Yes, Sexual Assault Forensic Examiner. And the reason why is because the Sexual Assault Forensic Examiner doesn't have to be a nurse. It could be a doctor, it could be a PA, or it can be an MP. So that's the difference between when we use the word SAFE, Sexual Assault Forensic Examiner, as opposed to Sexual Assault Nurse Examiner, and both acronyms are used in New York State.
And we mentioned at the beginning of the program that RUMC is Staten Island's only center of excellence for sexual. How do you get that designation, and what goes into training for someone like yourself to become a forensic nurse?
Well, we have, according to the jurisdictional laws and also Department of Health will be the one to qualify the hospital. And so there's certain guidelines and requirements that the hospital must meet that, to be designated as a center of excellence. Also, the hospital should be able to have a certain amount of trained SAFE nurses. For a nurse to be trained as a SAFE, you have to be a registered nurse and then go through a 3 to 4 days didactic training, which includes online, private, in-person, and then also after that you have to go through some skills lab, and then also do competencies, and then once you're able to practice on your own, you can maintain your certification every 3 years with 16 CEUs.
Wow. Well, I mean, obviously this is a service that we wish didn't have to exist.
Yes, I know.
But it is reassuring to know that for survivors of sexual assault, there's a team of individuals like you and your team that are out there to help them every hour of the day. When we come back, we're going to be joined by 2 community partners who work hand in hand with Issa and her team to provide additional services, including seeking justice for the victims.
We're all just trying to keep things running for those who rely on us. That's why we don't have time to be sick with the flu.
We don't have time for delays. Ready!
We don't have time for spills.
Next.
We don't have time for setbacks. Let's be real.
Getting the flu shot?
Helps you fight the flu. Get a flu shot for yourself and those around you, too.
Eva Marie smoked 12,000 packs of cigarettes over 15 years. She quit, and now there's a new lung cancer screening that could save her life. You stopped smoking. Now start screening. No matter how much you smoked, early detection could save you. Talk to your doctor or learn more at savedbythescan.org.
We're back and continue our discussion about services available for survivors of sexual assault on Staten Island. We continue to be joined by RUMC's Forensic Nurse Coordinator, Issa Shonayan. Now joining us is Rhiannon Latour, Bureau Chief of the Special Victims Bureau of the Richmond County District Attorney's Office, and Kirsten McGinnis, Supervising Social Worker here on Staten Island for Safe Horizon, a national organization dedicated to providing support and services to victims of sexual assault. Welcome to the show.
Thank you.
Rhiannon, let's start with you. We're going to start by asking, at what point does the DA's office become involved in an investigation should someone come to RUMC who is the victim of a sexual assault?
So that really depends. Not everybody who goes to RUMC as a victim of a sexual assault wants law enforcement involved. So we may never be involved in that patient's case. Others who do come with the police, and then we would be involved at that point once the PD gets us involved. So sometimes that's prior to the person being arrested, and sometimes that's after the person being arrested, depending on when police respond to a location.
Do you often come to RUMC, or do you see the survivors after they've left RUMC?
I don't go to RUMC. I don't. And part of that is because of patient health privilege. So I wait until I get consent for HIPAA to be able to get somebody's medical records. So police will go. I do not go to RUMC.
And is it difficult to get a conviction for sexual assault?
It can be very difficult.
Why is that?
And that's because almost every case happens in the dark, right? So people are not present for the commission of the act. It's a one-on-one thing. There's usually no witnesses. And then also witnesses don't come forward right away for the most part. Most survivors don't tell until much later. So at that point, we don't have the kind of evidence that people think should be in a case. So we may not have your medical evidence, we may not have DNA, we may not have anything else but that person's word about what happened. So it can be very difficult to secure convictions in sexual assault cases. Yes.
And do you have instances where victims of sexual assault come to the DA directly? They don't come to the hospital?
Yes, we do. We have had some times where people will contact the district attorney's office through their general info, have questions, maybe not even sure if they're the victim of sexual assault and just want to speak to somebody who's not PD. So we have had that happen, yes.
And how do you build that person's trust up? Because I imagine the legal process takes time, and having the trust of that person who knows they may have to testify, provide what could be seen as embarrassing information, how do you build up that person's trust?
So I start by meeting with people with a victim advocate. I never meet somebody without a victim advocate present, so they feel that there is somebody who can support them, who they can turn to. Somebody who will reach out to them, maybe refer them to services. So I always have a victim advocate present and I speak to them. And I think the most important thing is to be informative, to let them know what the process is, what to expect. And then as their case progresses, I always make sure that they are updated as to what's happening in court and what the next step will be. So I try to tell them everything that's going to happen so that at least they know what's going on and they're not in the dark about their case.
And how do you work with Issa and her team?
So I have worked with Issa and her team on a number of occasions. And that starts usually with the consent for the HIPAA laws to make sure that I can get the medical information. Because again, not everybody who goes to Issa wants their case, prosecuted by law enforcement. But whenever I need them, I always reach out and I schedule preparation, I schedule testimony, we try to do everything ahead of time. And I always try to prepare them for what is going to happen, just like I would any other witness.
And Kirsten, where does Safe Horizon come into this? What are the services that you provide?
So Safe Horizon is the nation's largest nonprofit victim service agency. We support children, adults, and families impacted by crime and abuse in the 5 boroughs. So the larger agency, our services can span the hotline, domestic violence shelter, child advocacy centers, court and criminal justice programs, legal services, counseling programs. But the partnership specifically with RUMC, we're connected through Safe Horizon's Staten Island Community Program. And so the Staten Island Community Program, we're located here in the borough, and we provide supportive case management, information and referrals, individual counseling, and safety planning to all victims of crime and abuse. And with RUMC, we support survivors who come to the ED for the forensic program. And so part of that work is that we're able to speak directly with a victim when they come into the emergency department. We can talk to them about their safety, about their rights, about their options. Safe Horizon, we also stock a closet within the hospital when garments are taken or maintained as evidence. We also provide materials and pamphlets so survivors can bring those home with them when they leave the hospital. If they need a safe way to travel home or to a safe location, Safe Horizon can cover a taxi service to get to their safe location. We also, if there are challenges with health coverage, Safe Horizon and my program can support a survivor in putting in a claim with the Office of Victim Services for prophylactic medication so they can have access to their care moving forward. And then lastly, if they want support moving forward following their hospital stay, is that, they can connect with our program for individual counseling, for safety planning, further information and referrals, or any kind of case management support that they might need following their victimization.
And this is through donations Safe Horizon is supported?
So Safe Horizon, we are a nonprofit, so we receive our funding through both federal, state, city, and through private donation.
And in a similar question that we've asked, how do you and your staff establish trust with a victim who comes forward to you?
Yes, it's really important. I think very connected to what Issa was mentioning earlier about making sure that there is established consent and a supportive environment. So something that's very important at Safe Horizon is that we take a trauma-informed and survivor-centered approach. And so that really helps build rapport and trust. So we basically want to meet a survivor where they are at and support them in their identified goals. And so, we can provide information and support, and then the survivor can make the decisions that are best for themselves.
And I have a question for all 3 of you. I mean, you're dealing with a subject that is, horrific, to be very honest. How do you go home and how do you decompress from some of the things you see and hear about, when you're dealing with survivors? And if you wanted to.
I try to focus on spending time with the people that I love and doing things that I love. And if I feel I need to speak to somebody, I speak to people who understand my job, who either do the same thing I do or know what it is that I do. So that's how I do it.
Kirsten?
I would say within Safe Horizon, we receive a lot of support around the impact of vicarious trauma. So being able to speak with colleagues and with my supervisors. Another thing that I find really helpful is engaging in advocacy events. I think sometimes that's a way to feel that you're within community and can see kind of the empowered agencies and survivors and community members that are speaking out against sexual violence. And so one of those events is Denim Day, which happens every April, which is a day that brings awareness to sexual violence. And it's a great way to connect with other organizations and survivors in the community that are speaking out.
Issa, how do you cope?
Oh, well, I use prayers, and I read the Bible because that's how I just release it, and I'm able to cope.
Now, you're an ordained minister, correct?
Yes, I am.
I
don't know about being ordained, but I'll take the title if you say so. Yeah.
Do you find that your spiritual training helps you in your professional career?
It does. It does. It does.
How does it help you?
Just knowing that the pains the patients are going through and showing them the love and compassion, I think that really helps a lot. And just being empathetic, knowing that, understanding what they're going through, and then just reaching out where they are. That's the most important thing, just reaching out where they are. So it's very rewarding when I meet with them, because we do follow-up visits with them, but only medically, not forensically. When I meet with them and I see a child says, "Oh, there's Issa," and she runs and comes and hugs me, or I see one of my patients and they're telling me they're doing well, that's rewarding to me. So yes.
And I guess lastly, a question again to all three. If there's someone watching who's the victim of a sexual assault or knows someone that has been, what would you say to them? What would you want them to know?
I would want them to know that people will believe them and will support them with the decisions that they make regarding their sexual assault.
Yeah, I share that they're important, that we believe them, and that we want to be present and offer support if they would like to come forward, either to Safe Horizon or to RUMC or to any of our other partner agencies.
Issa?
I'm going to echo what they said, that we're here. Yes, we believe you, and we hear you, and we hear your voice, and it matters. What you're saying matters, and we take it very seriously.
Well, in closing, I just want to say again that unfortunately this is a service we have to provide. We wish we didn't, but the fact that you and your colleagues are here 24/7 to help victims of this horrible situation is really a testament to each of you and what you do. And thank you for being on the show.
Thank you.
Thank you.
I want to thank all my guests for joining me this episode. If you or someone you know is in need of the services we discussed in this episode, contact numbers will be popping up on the screen. Please know that help is available and you are not alone. Richmond University Medical Center has cared for Staten Island and the New York City metropolitan area for nearly 120 years. You can help ensure that care continues by making a financial contribution to the hospital. Donations can be made in your name, the name of a loved one, or to honor a special nurse or doctor at Richmond University Medical Center. To donate, visit our website at rumcsi.org and click on the donate button located at the top of the home page, or you can call 718-818-2106. In the meantime, that just about does it for this episode of RUMC Vital Signs. Thank you for joining us. I'm Alex Lutz.